This is LiveWell Talk on medicine, color, culture, and equity. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's Hospital. Today's podcast is another installment of our mini-series where we discuss issues related to diversity, equity, inclusion, and what, as a medical staff, what we've called cultural competent healthcare. And returning to the podcast today is Dr. Dinah Conti, pediatrician at UnityPoint Clinic Pediatrics, to discuss gender issues. Dr. Conti, welcome back.
Thank you so much for having me again.
You know, unfortunately, this is a complicated topic, and don't expect to, solve it on a podcast, definitely. But I definitely want to get into today, as we talked briefly prior to the podcast, just so people have an understanding of what it's about, and that it's not their responsibility to understand it, just to be aware of it and be respectful of it. So let's start. Gender identity, what does that mean? What or gender? When does gender identity become gender dysphoria, and how do you separate those two terms?
Sure. Well, first, gender identity is very simple. It's how a person views themselves. The majority of people identify themselves as the gender they were assigned at birth. So male or female assigned at birth, the majority of people do identify as that. However, not everyone does. And so your identity is who you see yourself as. And there really are a lot of different ways that people can view themselves. We think about that with our other characteristics, the things that we like or we don't like, the clothes that we choose, the things that we eat, the people we work with. But in this case, it really is internal. This is a really big part of us. How do we see ourselves? And so someone's gender identity is just that. How do you see yourself? And there are as many different ways of looking at gender and understanding someone's own gender identity as there are people sometimes. There are a lot of different ways that someone might identify their gender. So when we think about, male or female, well, that's really two boxes that they're bursting at the seams. There are a lot of people who don't find themselves in one or the other. And gender dysphoria is where your beliefs and your feelings about your body and your identity don't match. So someone who was assigned male at birth, who identifies as female, well, they know themselves to be female, but when they look at their bodies, they see something different. And physically something different is happening with their bodies than other females might experience who are cisgender, meaning they are assigned female at birth and that's how they identify. A transgender person would be someone who identifies as a different gender or no gender than what they were assigned at birth. And so a transgender individual could have gender identity difficulty because of how they look versus how they feel or how they know themselves to be. So that's where gender dysphoria becomes a diagnosis or a challenge.
And let's go through so you have sexual orientation,
Mm-hmm.
and you have gender identity. What's the difference between the two?
Yeah, sexual orientation is how we view other people, what we like about other people. So it may be who you're romantically interested in or physically interested in, what kinds of people or what genders of people you prefer to be with, in any personal way with someone else. Whereas gender identity, like I said, is how we view ourselves.
Well, I have to, confess that at one point, just with Catholic upbringing and, some of those issues, that I was kind of dismissive of this topic. And then I read, when Bruce Jenner was transitioning to Caitlyn Jenner, I read how his entire life he never felt right. And he felt so alone, and he felt like he wasn't himself. And then I thought to myself, here's a human being that's suffering. And the way for them not to suffer is to make that transition to Caitlin, right? And I thought, that really put it in perspective that I need to be aware of these issues, but I'm not here to understand them, because nor are they there to understand me.
Mhm.
Uh,
Right.
and and I think to be respectful in that, et cetera. Um, you you have to be mindful of that, because as a physician, you want to do a good job, and if you don't recognize social determinants, perhaps a language barrier, gender issues, you're not going to do a good job.
Right.
And,
Right.
and that's
We
that's what we're here.
really just like anyone we encounter in medicine, we have to meet them where they are. We have to be the doctor that they need us to be. Not the one sometimes that I even set out to be, not the, sometimes we come into the room with an agenda, and sometimes we have to throw our agenda out the window
Yeah, yeah,
because we have to meet people where they are. So if I'm walking into a room and I think that I'm going to be meeting a man, and when I walk in, I say, hey, I'm Dr. Conti. It's nice to meet you. How would you like me to address you? And the person gives me a female name and says, my pronouns are she, her. Well, you know what? I'm changing on the spot, because whatever I came into the room thinking is no longer possible. That's no longer an issue. Now I've got a different person standing in front of me than I thought I was going to have.
right.
They're still themselves. They're still the same person they've always been. It's just my perception of them has to change. And that's really how we are respectful of anyone we come in contact with, any of our patients or our family members or our friends, is, we meet people where they are. Um,
Yeah,
Now, I
I
will
think.
say, Dr. Arnold, that if you do a Google search for Bruce Jenner, you will find no one. Caitlyn Jenner is who Bruce Jenner was known as.
Also, it changes that, does it? Really?
Yes,
Even
because
like
if you
the
think about it, if Caitlyn Jenner was in there, if this person identified themselves as female and said, you know what, this male body I'm in doesn't fit me. Well, whatever they identified as inside is who they are. Now, not everybody starts with the gender they were assigned at birth and transitions directly to, another gender without going through some period of confusion or questioning. There's some people who are non-binary for a while because they're just not sure how they fit or how they see themselves, and then end up saying, you know what, I really am this gender. So for Caitlyn Jenner, yeah, we all knew her as Bruce Jenner, and she called herself Bruce Jenner for years, but that's not who she was. And so anyway, so yeah, so it you can see though that it kind of like, okay, when I think about someone's gender, wait, that just kind of blows my mind, because I
well,
knew
yeah.
that
Then
this
you get
person
into
was
the
Bruce.
whole, you know, any different, like we were talking prior to the podcast, that male and female, that's these boxes that are full with genetic variants, and
Mhm.
gender issues are different. So,
Yeah,
when people say,
absolutely.
well, there are only two genders, well, no, but there's two sexes.
Yeah, for the
In
most part.
part, for the most part. There are some genetic conditions. And it's like we said prior to the podcast when we were chatting, that as a physician, you have to be for one patient, you have to be fraternal, you have to be their brother, their buddy, and talk to them that way, and meet them at that level, because that's what works. And others, you have to be paternal, and you have to just tell them, you got to quit smoking. No, that's the end of the discussion. You have to take this medicine. End of discussion. And that's how they relate. And if you can't sense that, then you're not going to meet the patient where they need to be. I brag, I truly brag about the fact that I've never discharged a patient from the hospital against medical advice in 25 years of practice, because I've always met the patient say, well, why do you need to go?
Mhm.
Okay, well, let's formulate
Sure.
a discharge that works for you based upon what your needs. This isn't a prison. you're not locked up here. If you know,
Right.
because sometimes it's like it's a single mom. She's, I gotta get home and take care of my kids. Okay, well,
Right.
let's figure out how we're gonna get you IV antibiotics. Still take it, because what you're doing is you're meeting that patient where they're at. And I think that's the whole understanding of this issue. But I want to get into something. So how, like some girls, I have two daughters. Uh, th- they had a little tomboy phase,
Hmm.
and then now they're both athletes, but they very much the princesses that that they think they are, but spoiled princesses. But
I have a tomboy princess too. Yeah.
all right. So what's the difference between a tomboy phase for a girl and, I mean, all little kid, I remember putting on, my mom used to sell wigs, uh, in the old Kmart East, and it was called millinery, and they scars, and she actually had quite, even at her funeral, she had this following because, chemotherapy patients, women would lose their hair, and she was the only wig salesperson in town. And so she got to know these people. Anyway, so I put on wigs and dresses when I was
Oh,
5 and 6
sure.
with my cousins, goofing around. Um, try to walk in high heels.
Sure.
So when do we say that? What take us through that? I mean, some of that's normal.
Yeah.
When is it like, okay, this is something we need to talk more about?
Yeah. Yeah. So I will say that dressing up and taking on playing different roles or taking on different characters is something that makes humans so special. We do enjoy that kind of thing. We like to dress up at Halloween or at different costume parties and things like that. And a lot of us really enjoy that. It's one of the reasons that so many of us enjoy the movies and TV industry. People are playing characters. The thing is that makes this different is that I can play a character, but how I see myself, what I know myself to be, may be totally different from that character.
Okay,
And
that's great.
so, yeah, yeah. So for the kid who likes to, wear dresses and cowboy hats and play in the dirt digging up worms, well, how they view themselves is more important to me than what they're doing. I want them to enjoy what they're doing. How they view themselves is how I should name it, but it's totally normal, no matter who you are, to do dress up and play and to kind of try on different things.
Yeah.
But that happens with gender transition too, that for a lot of people who do transition either from one gender completely to the other or to non-binary or anything along this spectrum, um, sometimes people do try on different identities to say, you know what, maybe this is how I feel. Maybe this is how I see myself. And they may try something for a while and then go, you know what? I don't think this fits me. Let me think about something else. Maybe this fits me. And so they may try something else for a while. Um, and for some people, no one role ever fits. Wearing the dress with a cowboy hat and working a construction site and digging up dirt in your clothes, that doesn't, sometimes all of those things always go together, and that's okay too.
So at what, so when this topic comes up, people say, well, you're not eligible to make the decision to vote for a president till you're 18. But yet we're going to this is a little hyperbole. I'm going to let a 3-year-old determine their gender. So
Yeah.
so in your practice, how do you see that develop, and I mean, I'm sure there's times, how do you encounter that? So, I'm a parent of a child that is, sex is female, but they identify as a male, and they're kind of, that's the tomboy phase is kind of getting a little bit more intense. How do you handle that in your practice?
Yeah. So the first thing I would say is developmentally, we're not born with a good sense of ourselves. But by the time we're about 3 or 4, and definitely by starting school, the majority of people have a pretty solid identity of themselves. and for the majority of the kids that I see in my practice, when we do developmental screenings, or if you read the parenting books, one of the things we expect a 3 or a 4-year-old to be able to tell us is their gender. I don't necessarily expect them to be able to tell me if their parts fit their gender, because their parts are just their parts. So there's not a sexuality to that. And I think that's where the confusion about gender identity comes in. It's saying, well, why would I let a 4-year-old choose their gender if I wouldn't let them vote? Well, they're not actually choosing something, they're identifying. If I ask a kid at age 4 if they are gay or straight or what, that's inappropriate, because that's sexual. That's how they're seeing other people. And I would not expect a prepubertal child to have sexual thoughts or feelings about other people. But a gender identity, how do you see yourself? Absolutely. And we expect them to be able to tell us at 3 or 4, are you a boy or a girl or something else? And it's a question we ask.
And so what percentage of the time does they, when do they land on, okay, this is, well, you said sometimes they never do. Yeah.
Yeah.
They never do.
Yeah. Sometimes people never do. I will say that once I started asking the question a little differently, but before, I don't know, before 5 years ago, maybe, I asked the question, are you a boy or a girl? And it never occurred to me that I was leaving some kids out. And so when I made that change, I've actually been pretty intrigued by some of the answers, because kids, I'm a pediatrician, they bring their dolls with them and they want me to check out the doll or the stuffed animal too, and so we do their checkup. But I'll ask a kid, is your doll a boy or a girl or something else? And occasionally I'll get something else, and I go,
Huh.
okay, do you know what your doll is? No. Or she's both, or she's neither one. Okay, great. Well, fantastic. Then I'll ask them, what would you like me to call your doll? You know? Because then, okay, well, I can't make any assumptions here. I'm going to get this kid to give me some information. But it's about how we phrase our questions and how we approach people. And kids are smart. And kids are
Oh, God.
oftentimes very assured of themselves. You've got kids too,
Yeah.
that sometimes they're very clever. But if they don't know that something is an option, how, they don't know how they call themselves or how they think of themselves has a word, then they have to pick what's closest or what they think you want to hear. But I have, with my youngest kid, who's transgender in my practice, his parents identified him at 4, and didn't really have a great way to discuss it, except to say, we tell him he's a girl, but he always says he's a boy. Okay, well, so maybe he's a boy.
Yeah.
But so that took a few different sessions with the parents to really kind of help them get comfortable with this idea that it was really okay for them to meet their child's needs by calling him what he wanted to be called and letting him dress the way he wanted to dress. And that was kind of stressful for them at first.
Andy Peterson, the neurologist, and I were talking one time, and he's a physician leader in this sort of subject, uh, and lent a lot of expertise to the medical community. But he was saying that it's not unusual for him to have a teenager that's had all these neurological problems and positive review a system, can't, a lot of tests, can't really find out what's wrong with them, that he'll just say, how's your bring up the
Yeah.
gender issue. And
Yeah.
they what they are is they're having a gender dysphoria. They're trying to figure themselves out.
Yes.
And
Yes.
he solves it. But it doesn't just walk in to your office with a sign that says,
Right.
hi, I'm having this issue, because it probably feels so unusual.
Right.
Now,
It's interesting that you say that. When I look back, the very first transgender child that I knew in my practice, now this was 10 years ago, maybe a little bit longer. I haven't been doing this like a million years, but but, but I have been doing it for a little while, maybe 10 years ago. And the kid, I had seen this child at the time, had me call her female, and I would say what we would call gender non-conforming, meaning she never dressed like a girl, she never did the things that girls like, but she was a girl, at that point, was what she said, and I saw her many times over a two-year period for psychiatric concerns, depression, for chronic pain. We could not get a handle on this poor person's pain. She would have migraines, she would have body aches. We tried massage, we tried going to physical therapy, and she really struggled. And then at some point, I don't know why I even thought of it, but I said to her, do you feel like you're not, like you don't belong in your body? And she goes, yeah. like
Yeah,
like it's the wrong one. It
yeah.
hurts. It physically is painful because it was the wrong one. And so anyway, but I can remember that being like an aha moment. That sounds like what you're describing with Dr. Peterson, kind of a, oh, that's it.
Now, with- this is, I know this might be apply to adults as well. What, what do you recommend to the patient that's transgender? How do they tell the physician they are? I mean, um, because sometimes we're not going to think to ask about it.
Right.
Okay,
Right.
we're just gonna. And actually, I was doing reviewing a case recently, and it was female name, but had he throughout,
Hmm.
and I thought it was a typo. I thought this is a typo. It wasn't. The person was transgender. I was like, oh, okay. Totally missed it until I started. Before I even saw the patient. But anyway, so how should they advocate for themselves? I know
Yeah.
that's a hard question to answer, but what's your advice on that?
Yeah, well, and so I would say that I'm certainly not going to be the best person to answer the question of how does a transgender individual advocate for themselves, because I'm not trans.
Well,
But so I would say every transgender individual who does advocate for themselves, I welcome them to tell me how they do it. And I ask for advice sometimes about, I want to say this, is that the right thing to say? I don't want to be offensive. And if I am offensive in something that I say, I apologize and move on. I'm not going to, spend all day discussing it because it was wrong. I said it. I moved on. And
right.
usually people like that, no matter who they are or what the subject is. Um, what I do ask for young people though is if they can find one person that they do tell who is supportive and affirming, can you have that person help you out? Can you ask them, you know, how do I how do I tell my mom? Can you come with me to tell my mom? And in my office, I try to use a lot of gender neutral language. So instead of saying hi, boys and girls, I'll say hi, kids or folks. Or when I even talk about my own child, I, for the longest time, and still sometimes do say, okay, my daughter, this and that. But you know what? Does it really matter to somebody if I have a daughter or if I have a son? Most of the time it doesn't. So I'll just call her my kid, like, okay, my kid does this. But I think for people who are experiencing gender dysphoria, they're so aware of language and trying to figure out not only how to identify themselves, but how to identify those safe people. When I'm using a lot of gender neutral language, I'm sending that signal that I'm not making a whole lot of assumptions, or I'm not trying to put labels on a whole lot of people. And
Right.
so that can kind of give that sense of a welcoming environment. Um, and it's a long time been a practice of mine, and I recommend it for every healthcare professional. But when someone does come out to me, I thank them for telling me. That's a really big deal. It's a huge share. It's a very personal issue. And if somebody feels comfortable telling me, and I mean, and they've done it, wow, I'm really just thrilled. And I thank them because that was a really big deal.
Like I always say, you made a difference that day.
Yeah. Yep.
The days when you go to work as a physician and nothing happens, it's just kind of refilling medications and blood pressure checks. At the end of the day, you're like, I could have actually stayed at home and this day would have not been a whole lot different. But then
Right.
there's those days where there's emergencies and urgencies, and you can go home and go, hey, they needed me today.
Right.
And yeah, I'll go back tomorrow. So,
Right.
well, this is great information. And I think the take home point is just be understanding of the people you interact with. Treat others as you want to be treated, and just have some patience with our fellow humans. Thank you for taking time with us. Once again, that was Dr. Dinah Conti, pediatrician at UnityPoint Pediatrics.
Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.